So it's really great to follow Dr. Corbin because she kind of had the medical talks this morning, and then she was sort of a nice transition getting to the mind-body, but still talking about a lot of different things that relate to your medical symptoms. So today I'm going to talk about an area, we decided to be a little more specific this time, talking about communication and social support. Okay, and I don't know how many of you, I've spoken here before, and I've also spoken at some of the groups, so some of you may have heard me talk before, but I thought today I would make it a little more specific, and hopefully we can get some skills or talk about some skills that might be helpful for you. Okay, so just to get us started, so as I mentioned, we'll talk about social support and some communication skills that hopefully you'll find, and some strategies that may be helpful. So let me just talk just a couple slides about how I conceptualize living with a chronic illness. So very much like any kind of major life stressor. We know specifically, especially when you're living with any kind of chronic illness or you're a loved one of someone who is living with a chronic illness, one of the biggest things, the hardest things to deal with and causes a lot of distress is the uncertainty. Okay, so dealing with that uncertainty about the future. Oftentimes there are multiple losses that you're having to live with, whether it's some independence, it could be financial, it may be functional types of losses. And then there's a lot of changes in roles. Sometimes roles within the family, it may be roles at work, all of these things that put a lot of stress on you. I also want to recognize, because I do a lot of work with caregivers and family members, that, you know, whenever we're talking about any kind of illness, it's not just the person with that illness, right? It's their loved ones. And how many of you are here today, are here to support someone with scleroderma? Okay, great, wonderful. So you got some great social support right here. But it's important to recognize how stressful it is for all of you too, in terms of stress on the relationship, again, changing roles, as your loved one may not be able to do as much or may have more needs, then you need to adapt to help them with that. Financial stressors we talked about, and then sometimes just changing about thoughts about the future, what you had thought the future was going to be in store and how you may have to adjust that. So basically we know that illness, and today we're talking about scleroderma, places a lot of stress on the family unit. So I want to talk about that today, and also how you can use the support that you have in a really effective way. Because one thing I will say that if you look at the research in health psychology in my field, across illnesses, unfortunately there's not a lot of research with scleroderma, there's some good research with autoimmune disorders, but one of the things that really stands out is the importance of social support. So having people in your life that you can talk to, that care about you, that can provide support, really does make a difference in terms of when we look at different types of outcomes, of how people adjust to their illness, morbidity, mortality, etc. So it's a really key, important thing, and oftentimes people don't really think that much about it, you kind of take it for granted. So just to kind of talk about social support. So what do we mean with social support? It's kind of a term that we psychologists or researchers may throw out, but what does that mean? What is our social support?
Community, family.
Exactly, community, family,
Close friends.
close friends, could be co-workers, medical practitioners, right? We're providing support. There's different types of social support. Others that people can think of?
Support groups.
Support groups, yep, can be very helpful. So there's all different types of social support, people who help us. I talked a little bit about the research piece. We know that good social support is protective for physical and emotional health, improve quality of life. And I always want to stress that it is a quality issue, not a quantity. Okay, so it's not, what the research is very clear on this, it's not that the more social support, the more people you have in your social support network, the better you're going to do or the healthier you're going to be. It's much more about quality. Okay, and I'm going to talk about not only the quality or how you can really optimize that quality and how the people in your network can be so important and how you utilize that social support network. How many of you feel comfortable in knowing how to ask for social support? This can be a tough one.
I'm getting better.
You're getting better, good. It's a work in progress, that's great. So a lot of us don't even know how to ask, and it's funny because, as I said, I work with a lot of people with patients and then also family members, and it's interesting because, from the side of the person with the illness, they'll talk about what kind of support they need, and they feel like they're not getting the support they need, and they're frustrated, they might be angry, they might be sad. And then I'll talk to family members who may be telling me, I want to provide support. I want to help them. I'm feeling so helpless. I don't know what to do. And so oftentimes it's just sort of bringing together and figuring out how do we communicate with each other to really optimize so that from the patient standpoint, you're asking for the right type of support from people who can provide that type of support effectively. And I'll talk about that more in a minute. And from the standpoint of being the caregiver, loved one, family member, friend, that you're also reaching out and asking what kind of support can be helpful. Okay, so oftentimes it's just these two not quite coming together, but when you hear from both sides, they both really want support and want to give support. So we'll talk a little bit more about that. And then, do you know who to ask for support? How often do you think about, wow, I really have a lot of pine needles on my roof, and I'm really not up to getting up there. I don't think that's a good thing for me to get up there on the ladder and get those pine needles down. I wonder if there's someone that might be able to help me with that. That's a very different kind of support than you say, I'm feeling kind of down today, and I feel like I just need to get together with a friend or just someone to talk to, just to be able to listen and help pep me up. Do you think you could find the same person who could provide both those types of social support? I mean, maybe you're lucky there are people that are good at that, but oftentimes, so the first type of support is more tangible, right? Someone who can actually do something for us that will be helpful. The second is more emotional support, right? And the people who are really good at the tangible support may not be as good at providing that emotional support or vice versa. So that's what I'm going to talk a little bit about this matching, but I think one thing hopefully I want you to get from our talk today is this idea of just stopping to think first, what type of support do I need right now? And who are the right people in my network where I can seek that support? And who are maybe the ones that aren't that good at giving me that type of support right now? Does that make sense to you? So here, I already mentioned two of those types of social support. So when we think of social support, oftentimes I think we usually think about emotional support, right? So when we're feeling down or we've had a hard day, maybe we just got some bad news, maybe we're just dealing with a lot of pain or fatigue. We just want to be able to have someone that we can talk to who can maybe be, very empathetic and listen to us and kind of help us, feel better, just having that chance to vent and get some of that emotion out. So that's emotional support. Informational support is pretty much what it sounds like. And you probably can think of someone right away who's really good. Who are the people that we can go to when we say, hey, I'm dealing with a lot of pain right now or some kind of problems, and I would love it if you could research or get some information for me or help me find this information, right? So, and oftentimes these people can be really good at making decisions too. If we need help, I'm trying to decide, should I try this new treatment or should I not do something? These are usually people that are good at helping you find information, maybe do some problem solving, decision making, that sort of thing, right? Kind of the engineers of your friends, right? Friends who have that engineer kind of analytical thinking pattern. And then tangible support is what I just mentioned, the kind of people that, some people aren't so good at providing emotional support or they just don't feel comfortable with that. But, they're the ones you could say, hey, would you mind running down to the pharmacy and picking up my prescriptions? Or, hey, if you're going to the grocery store this week, would it be okay if I gave you a list of a few things you might pick up for me? Right? So, and oftentimes, there are a lot of people when they don't know what to do, but they want to provide support, they love being assigned those kinds of tasks because they feel like, I know how to do this, right? I could go to the pharmacy and pick up something, or I can get on the roof and get those kinds of things. So I want you to think about it when you're thinking about the support. What kind of support do you need? And then be aware of thinking about who's the right person or who are the right people in my support network that I can go to seek this support. Okay? Does this make sense to everyone in terms of how to think about this? Okay, because I think it's really important, because what I find in a lot of the work that I do with people is that it's just a mismatch. You know, oftentimes I'll see couples and one person will be saying, you know, I want this sort of support, and he just doesn't seem like he listens to me or doesn't know how to respond. He always wants to fix it, right? That's the Mars versus Venus, remember that? The women just want to be someone to listen, and the men want to fix it. I mean, overgeneralizing, but and so oftentimes we're just suggesting, well, let's try to see if we can find a better match. You know, maybe your partner might not always be the best person to provide that emotional support that you want, but maybe there's someone else, right? A friend, an adult child, something like that. And then what are the things that your partner might be really good at that they could do? Okay? So this matching is really, really important to be considering. Any questions about that before I move on, or any thoughts? Now, sometimes you may go through and kind of do sort of an inventory of your social support network, and you may feel like, I don't really have a lot of people in certain areas of my network. Maybe I don't have as much emotional support as I would like. So certainly there are things we can go out and create, you know, a larger social support network. And there are a lot of ways to do that. Some of you brought this up. Support groups are a great way to do that. Sometimes even just having someone outside your family or friends, so going to talk with a therapist or having someone, a counselor or a health psychologist, just to help with that adjustment, that you don't have to worry what you say, because they're, you know, it's not someone you're going to hurt or upset. Trying new hobbies or activities. I always really encourage people who feel like they want to expand their social network. I love this because it really helps you connect around a passion, or maybe you try something new that you've never tried before. I just suggested this actually to a friend in art class, and she already went to one painting class and just loved it. It was like this whole other side of her, and met all these people that love to paint, and sort of created now this whole new social network around painting and that passion and interest. So there are definitely ways that you can work at creating or adding to your social network, which can be really important and very beneficial for both emotional and physical health.
And there's something you haven't mentioned, is spiritual health.
Mm-hmm. Yeah.
And that's another good support.
Spiritual health is really important. You know, I mean, it can be whether it's organized or it's something that's very personal. Certainly people who go to church or temple or things like that have a social support network that oftentimes they can really count on and get involved in. But also that personal spiritual piece is also very key. So thank you for mentioning that. And that could be a way that you can seek out when you want to expand your social support network. That's a really nice thing that you might consider. All right, so let's talk a little bit about communication, because that is pretty important when it comes to social support. Right? I already talked a little bit about, you know, who to ask. So now we're going to talk a little more about how do you ask, right? So we know that communication problems are really common in families that are dealing with any type of major stressor, but especially illness. Because you know what happens, as I said, it's not just the person with the illness who is going through a lot of uncertainty and stress, but so are those who are close to them. And oftentimes you take, you know, couples, for example, where they've been each other's main, you know, social support and help each other through really difficult times, and suddenly there's a little bit of fear of, One person doesn't want to talk about their biggest fears because they're going to upset the other person. So it can be very stressful on a relationship, whether it's a romantic relationship or a child-parent relationship or close friends, because oftentimes there's that struggle in how do we talk about this. And also coworkers too. One of the things, another one of the things I often talk with people about is, how do I talk about my illness or my symptoms with people? And oftentimes I think people, you think that you're supposed to tell everyone the same exact thing. And I always say, well, first it depends on what you're comfortable with. Second, it depends on the relationship. A close friend or family member, you may want to tell a little more, disclose what's going on. A coworker that you just work with, you may not want to give them a lot of details. So I just tell people you have that power. You can make that decision on how many details you want to give about your illness or your symptoms or how you're doing. Any type of with scleroderma and autoimmune disorders in general can be so tricky too, because there's so much fluctuation. You have those days when you feel really good, and then you have those days where maybe you don't feel so good. You don't always know when they're going to come. And so sometimes it's hard for people who don't know you very well to understand that. So just knowing that you really can have control and decide how much you want to disclose to people, and it may vary depending on the relationship you have with them. Now I want to just show you, I brought a couple handouts, not that we will do them in here, but I thought these might be some things that you could do in your free time if you're interested. So this first handout, number 1, is the communication strengths test. And it's just something that you can do pretty quickly, but it will kind of help you think about, where your strengths are in communicating, and where maybe there's some areas that you'd like to work on or maybe challenging for you. Okay? So just areas of where it's harder, certain topics for some people. Sometimes there's topics that are very emotional, can be very difficult. So just to kind of something that you can do on your own that might increase your awareness of where are your challenges, where are areas that you might like to improve upon. Just to kind of, handout 2 has a couple of different things. So the first half of handout 2, some of the things I'm just going to go over right now, are kind of some nice things that sometimes we forget about. Even if we're really good, we feel like we're really good at communicating. So one thing is, this is really key, is, if you've got something, say you want to talk with someone about your partner or friend or family, and it's pretty important, is set aside time to talk about it, right? So it's never good when something feels rushed or you catch someone off guard. You're running out the door, you only have a limited amount of time, and suddenly you say to your partner, I really want to talk with you about the kind of support that you're giving me and how that needs to change. And they're running out the door to do something, or maybe it's in the middle of the Broncos game. I've learned with my husband, never a good time to really talk about anything during a Broncos game. So, pick the time. If it's something important, set aside time. You can schedule it. That's really a very good strategy. So one thing, and don't rush those important topics. The other thing is, one of the keys to good communication is good listening skills. Right? We all want to be heard. That's sort of a basic human need. We want to know that others are listening to us and they're attending to us. And this occurs through verbal and nonverbal kinds of cues. What are some of the cues where you think that maybe someone's not paying that much attention?
They're on their phone.
They're on their phone, right? That's the constant one.
Or text.
Yeah, exactly. I deal with that a lot with my students sometimes. Right? They're on the phone. What are some other nonverbals that show? What are the nonverbals that show someone's really listening and tuning in?
Leaning forward.
Eye contact, leaning forward. Yep. Eye contact.
Maybe repeating what they think you said just to be sure they're on track.
Yes, that is an excellent strategy. is to be able to, and you know, psychotherapy, when I'm training my students, my doctoral students, we talk a lot about that, how important it is to make sure when you're working with someone, you're actually hearing what they say. And so be able to repeat back, maybe not verbatim, but being able to say, wow, it sounds like you're feeling really sad. You know? So being able to repeat back what they're saying or what you think you heard, we call these reflections. And these are really good because then, if that wasn't quite what the person was trying to say, then they get a chance to clarify. And then they can feel like, okay, they really are understanding. So good listening skills are really important. We're going to talk a little bit about assertive communication in a couple more slides. But again, it's that idea of taking ownership of your feelings and being able to be direct, but not in a way that is aggressive. And sometimes for people it's hard to distinguish that, or that's why we're going to spend a little more time on that in a minute. But that is seen as effective communication. And then also, this is more of in the cognitive behavioral therapy, where we do a lot of work on thoughts and how our thoughts can become distorted and impact how we feel. Well, oftentimes this happens in especially emotionally charged conversations, where our thoughts may become distorted. I'm sure none of you have ever had this happen, but you know, someone says something and you immediately jump to conclusions about either what that means or what they're thinking of you, or mind reading what they meant by that, right? Those are usually distorted thoughts that they can completely derail effective communication. Where suddenly, you know, the one person shuts down because, oh, I think they just meant that as an insult to me, or they just said something that I'm interpreting as very negative, and then they're not even hearing anymore, and then the other person gets defensive, and it can create this cycle of where what if started out as effective communication became very diminished. So just be thinking about that too, that sometimes everyone has hot button issues, right? Things that we're all sensitive to, being aware if we're kind of jumping to conclusions or our thoughts are becoming distorted and it's impeding good communication. There are also some nice skills in when it comes to problem solving. Again, really basic things, but oftentimes when, let's say, we're sitting down with a friend or a partner or someone and we're thinking about some kind of a problem or something we need to make a decision on, we don't necessarily think about these steps. So the first one, which seems so common sense, but as we know, common sense isn't always common, right? It's just agreeing what the problem is. You know, this is where I see, again, a lot of families, especially couples, dealing with medical issues sometimes get stuck. That they've never first sat down and agreed upon what is the problem. So let's first agree to make sure you're talking about the same thing. Because oftentimes what happens is what one person thinks is a big deal is quite different than what someone else thinks is important. So first you want to make sure you're really talking about the same thing and the same problem. And then brainstorm possible solutions. So I don't know, some of you may, in the type of work you do, go through this type of process. You know, the brainstorming is really that time where you just want any kind of ideas. It could be very creative, outside the box, just come up with it if you need to write it down. No negative comments or no, oh yeah, but that won't work, or here's why this won't work. In the brainstorming process, it's really just coming up with different ideas and letting that flow without any judgment or anything. Just get them all down. Because sometimes those ones that initially one person may say, oh, that will never work, actually turn out to be, you know, in the end, maybe one of the best solutions. So it's better to just let that brainstorm happen, no judgment, and then you can go back and look at that. And then as you go back, you can find something that's mutually agreeable solution, knowing that not always is there going to be, you know, 100% on board agreement by both people. But it's trying to find which is the one that for us we can both live with. And then the other important thing is then later assessing, did that solution work? Do we need to go back and maybe revisit this, look back at some of the other ideas we had if it didn't work so well? Because that's another place where I see people get stuck. Well, we sort of decided this is what we're going to do, and now we're going to do it. It may not be working so well, but this is what we decided we were going to do. Right? So this assessment piece is really important. to go back and say, okay, how have you? It's been a couple weeks or a few days. How's it going? Do we need to reassess this? Does this make sense? Is this helpful? So I want to acknowledge that there are a lot of different barriers to effective communication, and they're different for everyone, and they very much depend on who the person you're communicating with is. So certainly fear can be one of those. Some people have a lot of anxiety, whether could be workplace related, or sometimes people have anxiety about even talking with the medical practitioners. Brings up a lot of fear, anxiety. Sometimes this somehow seen as someone above you, that I'm not smart enough, I don't know enough about this, I can't really communicate or be involved in this communication, or someone as below you. Refusal or discomfort discussing hard topics. This is one I see a lot of, more often sort of the protection or people are afraid that their loved one or someone can't talk about the hard topics, or it's too difficult. And oftentimes in my work again with sort of the patients and caregivers or family is that they really all they know they need to talk about those things, and they all really want to, they just don't know how, because there's so much of that trying to protect each other, and this will be too upsetting and it's very emotional. But in most cases, they all want to. It's just, how do you do that? And that's sometimes where it is good to have someone, maybe a professional or someone to help with that if it really does feel like it's stuck. Sometimes families just need that one time to come in with someone, a counselor or a psychologist or someone, to just kind of help them through that process. And oftentimes they do really well, and then they leave and feel like, we got that chance to really talk about that. Difficulty with concentration, attention, or memory. I think this is, certainly memory is one issue, but, even with attention in our culture now, I see this a lot. It's sort of like you have your couple of sentences maybe that say what you need to say, and then people tune out really fast, right? So again, it's that, that can be definitely a barrier. And again, it's that finding that, either that time, what's a good time to talk about this, or sometimes you have to say, do you mind setting your phone aside for a few minutes, or could we leave the room where your computer is, just so we can talk? So I think that's even more nowadays something we have to be aware of. Of course, language and cultural barriers, and generational barriers. Sometimes that can create a huge barrier, and whether it's, different generations trying to talk about difficult things. Just a couple others, unmet expectations. So it may be in the past the communication hasn't been very good with some people in your family or social support networks, and just sort of giving up on them or you don't even try anymore. That can be a barrier. I say give them another chance with some of these strategies we're talking about today. Different coping styles. Some people are very expressive, verbal, and some people are not. Right, and respecting that. And some people have different ways of communicating, right? Sometimes the sitting down face-to-face can be very intimidating for people, but boy, you go on a hike together and they tell you their life story, right? Somehow that feels safer. So sometimes just thinking about what's the best venue and given the coping styles personality. Self-confidence, we'll talk about that a little bit. We talk more about assertiveness. And then as I also mentioned, strong emotions. Right? So anger is one of the most common. When you're angry, that's not a good time maybe to sit down and talk with someone about something that you're upset about. Right? You might want to wait until some of that emotion isn't there, you've worked through some of that, and then talk with them. Guilt, sadness, all of those emotions. Just be aware of that, how that may be a barrier sometimes to effective communication. Now let's talk a little bit about communication styles. How many of you are familiar or feel like and you don't have to disclose this if you don't feel comfortable, but feel like you're able to be pretty assertive, at least in certain situations? Yeah. Okay, good. How many of you kind of would wish, you feel like you fall more in the passive, or you wish you were a little more assertive? And then, it's okay if you don't want to identify yourself, but also, there's also the aggressive, right? Now, can everyone, without reading all of this up here, feel pretty comfortable that they can distinguish assertive versus aggressive?
Yeah.
Yeah. Some yeses, some nos. What's the big difference?
You pay attention to other people's rights when you're assertive and aggressive. You don't know what they think.
Yeah, right. Or you may communicate in a way that makes them feel like you don't care what they think. You may care about them, but the way you come across, right? So there's one big key. If you're ever the simplest thing, if you're ever trying to decide, am I being assertive or am I being aggressive? So the biggest thing is the I feel, or using I statements, right? Because when we're aggressive, it's, you should have done this, or you shouldn't have done that, right? Versus saying, I felt really embarrassed when you did this behavior or did something like that. That's going to be very different, right? So I'm thinking of I feel statements because when we actually take that on, take responsibility in the communication and say, I felt upset when you weren't even listening to me or paying attention to me while the wrong was being versus you never listen. You care more about that team than you care about me, right? What's that going to do to someone? It turns them off, right? It puts a wall up right away. They get in a defensive. What is she saying about me? That I don't care about her? That's ridiculous. Who is she? Why do all this for? It just puts someone in a very defensive sort of place. And that's what aggressive types of communication does. Where assertive, it's very hard to get defensive when someone's saying, I feel hurt or upset when you're not even listening or don't seem to be listening when I'm trying to talk with you during the Broncos game, right? Because then you have a chance to say, well, oh, I'm sorry. I didn't realize that was upsetting you. Oh, let's come up with a solution, or let me try to be better, or what can I do to improve? Okay? So it's really key because it kind of sets the tone for whatever it is that you want to talk about. So, and I have a nice handout for that. So handout number 3 is some nice reminders where it defines the kind of 4 common communication styles. So aggressive is standing up for yourself, but also stepping on other people's toes, right? So not respecting their boundaries, their feelings. Passive is the opposite, where we don't speak up for ourselves. We tend to do what we think other people want us to do, or just not express how we're feeling, okay? And the advantage, all of these have advantages and disadvantages, right? When you're aggressive, people usually don't bully you, right? They're going to kind of leave you alone. But that's sort of the disadvantage too. They start to avoid you, and they don't really want to be that close to you. With passive, people who tend to be passive are people who are really uncomfortable with confrontation or conflict. So in that sense, that they avoid conflict, but it also impacts their self-esteem because they're feeling like, I'm not standing up for myself. No one's really listening to me. I'm not having a voice in all of this. So over time, it can really lead to a lot of resentment and guilt and all kinds of things. Passive-aggressive, we haven't really talked much about, but again, it's more people who are passive-aggressive tend to first want to avoid conflict initially, so they come off as very passive, but then what do? They kind of go back and get you, right, in a way that you don't expect. So they tend to avoid conflict, but then later something else comes up in sort of an aggressive way that you may say, hey, where is this coming from? So passive-aggressive is usually not a very good communication style either. So people who are more passive-aggressive, it's really important for them to kind of learn how to have a voice and be able to be more assertive. So they don't feel like, oh, I said yes to this initially, I didn't really want to do it, so now I'm going to do something kind of to get back at that person, right? Because I didn't want to say yes to that in the first place. So there's some nice tips for assertiveness communication. Just some examples, again. So in its simplest form, it just means simply asking for what you want. So it could be making straightforward requests like we have here. It would mean a lot to me if you would pick up your shoes from the middle of the hallway. Good with kids too. You can tell I have kids. It would mean a lot to me if next time we're in this situation you would do this. And the more severe, may I finish my sentence, please? Right? Because sometimes people who are more passive tend to get kind of run over in communication. And sometimes just by sticking up and saying, I'm not finished yet, can I please finish? Can be very helpful, and also reestablish sort of boundaries that can be essential for good communication. As I said before, the I want and I feel statements are really key. And then the other thing is acknowledging in your assertive communication, also acknowledging the other person's feelings. So recognizing the other person's situation, feelings, beliefs, etc. Right? So not just your feelings, but being able to say, okay, I understand why maybe you weren't able to do this for me, or why you weren't really listening, because maybe you were so engrossed in the game you didn't even realize I was talking. So this is nice. You could refer to this for some assertive communication kinds of things. I want you just to be aware that there are barriers to assertive communication. In this cartoon, she says, if I was assertive enough to speak my mind, no one would speak to me. Okay? And this is not that far-fetched, because a lot of people who are not used to being assertive, first they're afraid of how are people going to respond to me. I never speak up. And if I start speaking up, what are they going to think, right? And I will say, especially when we're talking about families, there is that adjustment, because families are systems. And so one person in a system sort of changes their communication style. It's going to initially impact everyone else. Like, whoa, mom's being assertive now. What does this mean? So there's some adjustment that takes place, but over time it can be very effective. But it's important to recognize that. Right? If people have been in situations past trauma, things like that, for folks sometimes it's hard to be assertive, it's hard to speak up. But it can be very empowering to learn how to be assertive and really speak your mind and share your thoughts and beliefs. I just want to touch quickly on communication between couples. If you go back to that handout 1, there's a nice little list of handout 2, the second half. Rules for good communication, couples communication. Now this comes from some really extensive research with some well-known couples researchers over years and years. And what they did, just to kind of give you a sense of, they went and for years and years they had their research lab, they did couples therapy, they had couples come in. Some of them had been together for a short amount of time, some had been together for years. And they videotaped them while they were talking about different topics that they gave them. And over the years, they looked and then they would go and transcribe this and look for different types of things, topics, qualities in this communication. And then what they were able to do, because this was some great longitudinal work, is then years later, they were able to predict based on how many positive to negative qualities these couples were showing or demonstrating with each other, predict which couples were still together years later. And so what they found is that there are these positive qualities. You want to think of, ideally, having no negative qualities in the conversation, communication would be the ideal. But we also have to be realistic, right? That doesn't often happen. But what they found is if at least it's a 5-to-1 ratio, so there are about 5 positive qualities in the communications between couples to every 1 negative, that seemed to be okay. Those couples seem to do okay. But when that ratio of negative qualities changed and there were more of the negative qualities, it was more than that 5-to-1, then that's where they saw couples that really had problems. So it's really key in showing how this communication is really important, and it's what we say to each other, right? So I like this, and there's books on this I'd be happy to share if you want more information, but I thought this was just a nice sort of thing to think about with your partner and what you're saying to each other, and maybe have some adjustments in that, and being a little more aware and mindful could have a huge impact on your relationship and the quality of your communication. So just some things to think about. Last one, I just want to go through this, and then this will be it, is communication with your medical team. So just some nice, helpful hints, and some of you may already do this, but it's also always good to write down questions ahead of time. And sometimes I hear the physicians that may not always appreciate that when they see the long list. But I always tell them, I think it's good, because otherwise what sometimes happens is people have in their head important things they want to talk about. And then it's called the doorknob phenomenon. We see it in psychology too. The doctor's at the door about to leave, and then the patient says, oh my gosh, I need to talk to you about something really, really important. In psychology, it's about, we need to talk about my relationship with my mother. Did I tell you about this trauma, or whatever it may be? In medicine, it happens too. So I think having your thoughts, your ideas about what you want to talk about, knowing that in a limited time, you may not get to all of them, so I also recommend prioritizing them. Sometimes you may need to set aside separate time, but that can be very important. Bringing a friend or family member with you can be great, especially when we're anxious. What happens? We don't hear. It kind of goes in and we don't hear. So having a family member, or sometimes people, if the office, the physician, they're okay with it, they may audio tape. They can't have someone with them, so they can go back and listen. Don't be afraid to ask questions. This is a good place where you can practice your assertiveness skills with your medical team. Be assertive and feel that it's your right to be able to speak up, especially if you don't understand something. We try not to use too much medical terminology, but sometimes it just happens. And I do trainings with physicians and medical teams on how they can communicate better with their patients. And we always talk about try not to use too many medical terms. But from the patient standpoint, you need to speak up if you don't understand something. And you can also repeat it back. So reflection is a great thing to use here. Okay, so what I think you're telling me is I need to take 2 of these pills in the morning before breakfast, and then I need to take 1 at night, or that kind of thing, could be really important. And oftentimes in medicine, they're getting better at that with people, asking them before they leave, can you repeat back what you understand you need to do? So that can be very, very important. The other thing is, so going back to the list, is trying to be as concise and succinct as possible. So interestingly, and I just found this out as I was working on this presentation, so there are studies that show that you have 23 seconds to speak before your doctor interrupts you. I know we have, Dr. Fisher is not one of these. He's very good listener, but it's a reality of, and I'm not just talking about physicians, whether it's the nurse, the pharmacist, oftentimes they have very limited time. So it's being able to figure out what exactly is my question, or what is it that's worrying me about this? How can I say that, be as succinct as possible and clear, right? And knowing that, it may be that you need to schedule a separate time, either a phone call or another visit to talk more in depth about it, but at least having that chance to speak about what's concerning you.
So I like the way that you're saying to the patients, there is this thing where you only have 23 seconds to get your question. And so you know that there's this problem, and this is how we're going to address the problem. But with my students, when I say to them, studies show that your patient only has 23 seconds to talk before you interrupt them. How do I make my students be better? You don't want them to be better at cutting people off at 23 seconds.
Right. Yeah, well, that's a great question. So, I used to do more work with students and sort of training them, there's that art of like open-ended and closed-ended questions. And students recognize, that's why I think sometimes the list can be helpful, because if a patient walks in with a list of things, you're going to know, wow, we've got to be pretty, either prioritize, or there's a lot of stuff here. If you don't know what's on their mind and then they keep bringing things up, I think it's less organized. The visit can be less organized. So I think maybe students, starting at the very beginning of prioritizing with the patient, what are the things that are really important for you that you wanted to talk about and discuss today?
So when I tell my students, when the patient sits down, first thing you ask them, what's your primary concern? That's a good thing.
Yeah, I think that's a good thing. And then following up, are there other things that you're concerned about? So, yeah, so I think that's a great thing to figure out. And it's always a challenge with we have such limited time now on both sides. So it's important that communication, I think, is even more key than maybe it used to be. So I see my time is up, so I don't want to overtake my time. Just to let you all know, if you want more information, I'll be happy to talk with you about this. The takeaway message you can see in the slides. And thank you for your attention. Appreciate it.